Hi, everyone. It's Jessica Drummond here from the Integrative Women's Health Institute. And we have quite a few people on the line here this afternoon. Great to see you. So type in the chat box where you're from, what your profession is. Are you a fitness professional? Are you a physical therapist? Are you a health coach? Where are you coming from? Just so I can say hi and get a feel for who's here with us today. Hello. Oh, yeah, we've got some people from the UK and yep, lots of different states, Texas and Chicago. Hi from Houston, physical therapist from Canada. Hi, Crystal. Great to have you here, Shauna, from Phoenix, Arizona, Phoenix and Scottsdale, Arizona. Women's health nurse practitioner. Excellent. Hello, we've got a personal trainer. Hi, Fatima from Toronto. Beth, Colorado. Oh my gosh, all over Canada. Yoga teachers, lots from Texas. Great. Lots of people from Canada here today. Good. Hope it's nice weather out there today. I'm coming to you from Connecticut, about an hour and a half outside of New York City. And we're going to go ahead and jump right into discussing, chatting all about nutrition for female athletes. And I think you'll see that I take a woohoo, Austin. Actually, I'm going to be in Austin in about 2 weeks. I'm going to take a little bit of a unique approach to making some deliberate choices about what nutrition recommendations to make for my female athlete clients, depending on lots of different things, including what phase of the menstrual cycle that they are in. So let's jump right into the content. We have a lot to cover, and now that I've met you a bit, I can tell that all of you are busy and have lots of stuff going on. So let's jump right in. So we're going to talk today about 3 specific objectives. Do the different phases of the menstrual cycle affect the nutritional needs of female athletes? And clearly, I believe yes, and I'll explain that in much more detail. Is it best for female athletes to just be on continuous birth control so that they can suppress their menstrual cycles altogether? I've had this question posed to me by 2 of my colleagues just this week alone. So I thought this is a big one that needs to be answered. And finally, how can women's health professionals support women specifically during the follicular phase? So we don't really have time today to get through the whole menstrual cycle because there are several different phases and they each have unique attributes, unique data. But we'll talk in particular about the follicular phase, both the early and late follicular phases, which are really 2 distinct phases of the menstrual cycle, to optimize women's performance and minimize their injury risk, in particular during those times. Now, as I said, clearly we can't cover the depths of women's health nutrition for female athletes just in our time together today. So at the end of this presentation, I'll share a resource with you to support your continued education on this topic if you're at all interested. If you're not interested, that's perfectly fine. We have a lot to cover right now today. So the question is, does the menstrual cycle actually affect the nutritional needs, in particular of female athletes? And let's start by taking a look at the menstrual cycle in general. And this is a handout that I give to a lot of my women clients, particularly those who are moms of teen and tween girls. And when we start to, I'm in my early 40s and I now have a tween daughter. So if any of you are in that situation, you understand that suddenly there's a lot of cycling going on, in the household. And so the more we understand about the biological impacts, the mental health impacts, the energy impacts of the various phases of what the hormones are doing throughout the cycle, the easier it is we can apply it to any area in our lives. So today we're going to be talking in particular about female athletes, but really this can be applied in so many useful situations. So day one of the menstrual cycle is when the woman starts to bleed. So that's your day one of your period, bleeding. Then for the first few days, and there's some variation that's within normal limits of how many days certain phases last and so forth. But if we're looking at kind of the standard textbook 28-day menstrual cycle, the first 3 to 4 days, all of the sex hormones, estrogen, progesterone, testosterone, are at their lowest levels and sort of just hovering at a low kind of normal level for when women are actually menstruating. Starting around day 3, 4, 5, maybe 6, all 3 of those hormones, the levels begin to rise, particularly estrogen and testosterone. In fact, just before ovulation, so this would be the early follicular phase, is when those first 3 to 5, 6 days when a woman is actually having her period, when she's actually bleeding. Then, days 5, 6 or so, all the way up to ovulation is the late follicular phase. And that's when estrogen levels are rising. And importantly, testosterone levels go to their highest level in the whole cycle. And so women are more sexually interested during the time of ovulation. Their libido is naturally the highest, but there are other benefits, non-sexual benefits as well to that late follicular phase. And we're going to talk about how that applies to female athletes. Then you have ovulation. After ovulation, estrogen and testosterone drop. Progesterone and then estrogen again begins to rise. Progesterone is highest in the luteal phase, and estrogen has a bump, but it's not as high as it was pre-ovulation in that late follicular phase. And then all of the hormones, fall just before the period begins again for the following month, unless, of course, the woman is pregnant. So we're going to dig into how this impacts athletes. So estrogen is highest in that follicular phase just before ovulation. And what that means physiologically from a nutrition standpoint is there's decreased reliance upon hepatic glycogen stores, so stored sugars in the liver for energy during exercise. During that, when estrogen is high, women can use fatty acids, so stored fat, or they can use fat, dietary fat for energy during exercise most easily when their estrogen levels are highest. And they are less likely to break down amino acids or proteins. So think about that for a moment. If you've got a client who's really struggling with fat loss, you want to maximize her dietary fat during estrogen, the highest estrogen phase, and really tap into fat burning forms of exercise like high intensity interval training, strength training during those the highest estrogen times in her cycle. And if you have an athlete who's not trying to lose weight, she is going to need even more dietary fat, to sustain performance gains during this high estrogen time. And it's also, again, a time when she can really make high performance gains because her testosterone is also at its highest levels. So menstrual cycle phase matters quite a bit. It's not the only factor when you're thinking about which kind, fatty acids, glycogen stores or glucose, which will come from carbohydrates or stored glycogen in the liver, fatty acids, which will come from either dietary fat or stored fat, and then amino acids, which will come from either dietary protein or muscle. What we want to avoid in almost every case is breaking down muscle, because the more lean and strong that your athlete is, the better her performance will be and the healthier she'll be. So not only do these hormonal fluctuations of the menstrual cycle impact the dietary choices, but, well, I guess I don't really mean the dietary choices. What I mean is not only do the hormonal variability impact which substrate the body will use, carbohydrates or glucose, fatty acids or fat, or proteins or amino acids, but which of those substrates are available. So it's harder for the body to access stored fat if it's being fed a lot of glucose, which is an easier substrate. Carbohydrate, fat, or protein is the choices of substrates, and carbohydrates are the easiest for your body to utilize for energy. So if your client is eating, for example, like simple sugars on her long run, she's not going to tap into her fat stores because she has that glucose readily available right there for her to use. So even if her estrogen is high, if she's eating a high carbohydrate diet, she's not going to utilize fatty acids, which is the preferred substrate during those times of high estrogen. So we want to be careful of giving our clients these high energy, really high carbohydrate bars, because when you're in a relatively high estrogen phase, you would prefer them to be burning either dietary fats or stored fat, depending on the situation. Now, it doesn't mean we're eating fat to the exclusion of everything else, but we're thinking about fat at least 30% of the diet. We don't want them to be eating a lot of junk carbohydrates, which will impact the endocrine system, but it will impact the endocrine system negatively by causing imbalances in blood sugar and insulin response, and problems with insulin responses and insulin resistance. So the menstrual cycle is just one piece of the puzzle, but it's an important piece of the puzzle that's very often overlooked. Other well-controlled studies showed no difference in menstrual cycle phase on substrate utilization, but it's because the researchers believe, as we just mentioned, if a woman is not eating in a way that will support the natural benefits of her hormonal cycle, then you're going to have other factors take priority. So it depends on how much energy she needs. First of all, is she training, or is she resting? Is she injured? It will depend on if she's on oral contraceptives, and we're going to talk about that in a little bit. And it will depend upon her recent exposure to carbohydrate nutrition, because that's always the substrate that's the simplest to use, but it's not always the best option. And then finally, the menstrual cycle effects. So when we're talking about performance enhancement, we really want to consider what the activity is that your client is trying to improve. So this study was done on 13 male and 16 female trained CrossFitters. These athletes were all in their 20s and 30s. They had 19 grams of a pre-workout drink, which included extracts of pomegranate, tart cherry, green and black tea, which are commonly used as antioxidants, 30 minutes before their exercise, and then a post-workout protein supplement. So the females got 20 grams of protein and the males got 40 grams of protein. They also included in that supplement 40 grams of carbs for the females and 80 grams of carbs for the males. That supplement was consumed immediately after each workout, compared with the control group, which was just having water pre and post their CrossFit workouts. And the result was, with this supplemental, combination of protein and fat just after exercise, there were improvements in VO2 max, which is a measure of endurance, and anaerobic peak power, a measure of strength. and improvements in performance of some particular kinds of workouts. So depending on, if you've done CrossFit, what the workout of the day was, some had performance benefits just from supplementing their recovery and using some antioxidants prior to exercise. Now, this study did not take the menstrual cycle into account. I would imagine that if they had considered doing a fat recovery, a supplement that contained some fat during especially the late follicular phase for the women athletes in the group, they may have seen even greater performance advantages and greater improvements in strength and VO2 max. Now, we see that a lot of the female athletes in my practice and in many of the practices, if you look at the data, are just generally lacking in both energy, total amount of caloric intake needed. But we know now that, food is not just calories. Food is information that really impacts the expression of our genetics. So when athletic clients are just simply undernourished, both with energy and with nutrients, they have lack of information to their genetics, and they have lack of essential vitamins and minerals to be able to perform at their best. So low energy in female soccer players was found to be related to just low intake of carbohydrates and low calories. They're just not eating enough, which is a very common problem, especially for clients who are shifting to more nutrient-dense, healthier diets. A lot of times they just simply need to eat more food. And they didn't find any difference when they use sports drinks or energy bars or gels. We really want to bring it back to the foundation of feeding our athletes real whole foods in relatively high amounts before we start adding supplements. So, if you think about the kind of snacks that you'll see at a local 5K or, your daughter's soccer game or at the gymnastics meet or a master's swim meet, you're not seeing whole foods, proteins, high in amino acids, fatty acids from nuts, from olive oil, from coconut oil, shakes and smoothies and avocados, nuts, seeds, really good, healthy, nourishing fats that can stimulate performance gains, especially in the follicular phase. And then if you are feeding your athletes carbohydrates, are they nutrient-dense carbohydrates so that they're providing the complementary vitamins and minerals that are needed by these biochemical processes to make the fat utilization most efficient? So, fruits and vegetables, not, chips and Girl Scout cookies, right? So now we do have to be mindful. Feeding female athletes is a very distinct thing from feeding male athletes. The rate of lipolysis, so that's the breakdown of fat, is elevated 21 hours after intense exercise. So someone who's pedaling for 90 minutes at a pretty intense rate, 45% of their max endurance, or for 60 minutes at 65% of their max endurance, in males, their fat breakdown is going to last for 21 hours after they do that exercise. But for females, you don't see that kind of fat burning after exercise. So the fat burning window that we have for women who are still premenopausal and they're cycling is that late follicular phase when estrogen levels are highest. They have the energy, the focus, the ability to train at their highest levels. Their testosterone is highest. They should have lots of energy at that time. Then you're going to have your best utilization of fat for both performance gains and for improving the body composition in the late follicular phase. This is very different from men who at any point in time continue to burn fat after any high intensity exercise for nearly another full day. So females use more fat during exercise. So they do need to be fed at least that 30% fat, especially in the high estrogen time periods. But males continue to burn fat for many hours post-exercise. So we don't want to overdo fat replenishment in the recovery phase for women. It's not the same as for what men need. Now, after exercise, when there's an intense exercise, when women need that fatty acid energy boost, it is taken sometimes from intramuscular, so stored in the muscles, triglycerides. So that's a form of stored fat in the muscle. The lipid intake for long distance female athletes, so like long distance runners, even athletes who are doing like long skating programs, long distance skaters, cross country skiers, needs to reach 30% of the daily caloric intake to ensure rapid restoration of the intramuscular triglyceride stores. If the post-exercise fat intake is insufficient, the body will start depleting these stores, and that can last for up to 2 days after exercise. So if you have a female athlete who's a long distance endurance athlete and she's not eating enough fat and she's training very heavily and she's got a competition a few days away, she may not have that stored energy that she needs to access for those longer distance events. In a study where the athletes were submitted to 2 hours of running following a short-term low lipid diet. So in this diet, they had just 3 days where they only ate 10% fat. There was a dangerous change in the athlete's lipid profile. That low-fat diet increased triglyceride concentration, which is a negative for cardiovascular health. So it's one thing to have a triglycerides stored in your muscle, that's okay, but triglycerides in the vessels is a risk for cardiovascular disease. And decrease the concentration of HDL cholesterol, which is the good or protective cholesterol. So this is a risk factor for cardiovascular health. When you have long distance endurance runners or other long distance endurance athletes who are not eating enough fat, they are actually risking their cardiovascular health, and particularly during these high estrogen times when the body naturally utilizes fat more as a substrate. So let's talk about the menstrual cycle and the female athlete in a bit more detail. So when your client is in her early part of the cycle where she's actually bleeding, this is where we want to think it's an ideal phase for restorative exercise. So is your client getting enough rest, enough restoration? Maybe doing some restorative yoga practice, maybe a gentle workout, flexibility training, extra sleep and rest. We always forget that performance gains don't happen when we're pushing. Women really need to tap into these natural cycles and take rest when the body needs it. Now, if this is her most important event of the season and she's in her heavy menstrual bleeding days, then we use a strategy that I call scaffolding. So, you've got someone taking care of everything else. She's got friends and family cooking for her, someone watching her kids, she's getting extra sleep, her bag's packed in advance, she's eating really nourishing food. Maybe she gets a massage the night before the event, she gets extra sleep. We really focus on optimizing everything else so that she can focus all of her energy on that important competitive event. And without that, you're just pushing her to utilize her, high energy stores, her resilience, and a time when naturally she should be in more of a recovery phase. So we've got to scaffold time periods that are intense if it's not in alignment with the physiologic cycles. So then we talk about the follicular phase. So after the end of menstrual bleeding, that finishes that early follicular phase, moving into kind of the end of week 1 and the beginning of week 2. This is the best time for, a more masculine energy, competition, creativity. This is when you want to push your female athletes. They should have great strength gains, great endurance gains, might be more creative, might be able to improve agility. There's so much improvement that can happen if, again, they're well nourished, they're not nutrient depleted, they are eating plenty of fats, lots of nutrient dense foods, still getting good sleep, but they don't need it as much as in those other phases. Week 3 and early week 4, we start to move into that luteal phase. This is the best time for inner work. So sports psychology, intuition, strategy, learning more about the competition, reading the competition more easily. Let's say you're in a sport like a soccer or basketball where you've got to react quickly to how other players on the other team are, and even your own team are working. That intuitive muscle is strongest at that time. Focus then on the training details, expansion, growth, but don't forget that there is a time every month where women need to restore. Now, men have hormonal cycles as well, but they're daily. So their restorative time is naturally every night. And I think for women athletes, we really need to understand their natural cycles to be able to use them to their utmost advantage. And restoration, recovery, restorative yoga, all of those kinds of strategies, nourishment, sleep are so essential for getting performance gains or the next cycle during late week 1 and week 2 during that follicular phase. So during the early follicular phase, she may feel fatigued, mild cramping, other period symptoms. This is because her estrogen and testosterone and progesterone are at the lowest. So we're going to focus on scaffolding, what I just explained. Support with childcare and all kinds of help if she's got a busy competition at that time. If your client, here's important. So we talked that one of the most important things you're going to learn today is about screening. If during her period, she's got intense cramps, bad headaches, severe fatigue, super heavy bleeding, irregular bleeding, these are red flags for deeper health concerns, and we really want to look for those things and pay attention. Don't just mask them with, ibuprofen and taking a few days off. There could be some serious underlying conditions that the first sign of could be menstrual problems. So we want to help her if she does have a big competition during this early follicular phase to create support networks for childcare, sleep, massage, lymph drainage, skin brushing, pre-preparation of the race day meals, lots of hydration, build support on the sidelines. She wants to feel really emotionally supported and create that essential time for rest, restoration, and recovery. If she does have painful periods, one supplemental support that can help is fish oil and other antioxidants. So that CrossFit study where they were given, tart cherry and pomegranate and so forth, those are antioxidants. Fish oil is anti-inflammatory. Your client should be eating roughly 12 to 16 ounces per week of low toxin fish, especially again during that high fat phase. And remember that high intensity exercise itself actually increases inflammation. So we need to support the body to be able to recover from that inflammatory stressor. It's a good stressor, but it's still inflammatory, and the immune system needs to be able to resolve that quickly, which it can do if it has adequate access to things like antioxidants. And again, if during the cycle there are serious symptoms, those are big red flags you want to be aware of. Now, the late follicular phase has been called by some researchers, writers, and physicians the Venus week, meaning this is like the awesome week. It's not, I don't think at all related to Venus Williams or anything like that, but this is the time where estrogen and testosterone continue to climb. She's going to have her most masculine energy, which in a lot of sports can be a real benefit. And by this, I just mean high energy, linear thinking, pushing, productivity, more focused, not less intuitive, which could be a disadvantage depending on the sport. The other challenge, though, with this period is with a relatively high testosterone level. It's still about 10 times lower than an average male's testosterone level, but it's important in terms of its impact on women, is that with elevated testosterone, your athletes are going to be at their most risk-taking, which again could be great for competition, but it may also set them up for greater injury risk. So we've got to be mindful of them making sure that they're aware of this increased risk-taking behavior that occurs with elevated testosterone so that they can manage it better and make discerning choices. So there's less need for scaffolding, but if your client has a big competition at this time and is really well supported by her coach, her family, her friends, she has a great opportunity to reach her, personal record or highest potential, make some huge training gains. This is a week that we're really focusing on performance and gains. Now, why don't we just put female athletes on continuous birth control pills and just take this whole thing, out of the equation? Why do we have to be thinking about what phase of their cycle they're in at every moment? Well, there are some costs to the athlete some risk for being on continuous birth control pill. And I'll go through these in detail in a moment, but to lay them out, sexual side effects are common. And the thing that is most concerning to me is that there's a loss of the benefits of the natural hormonal shifts in the cycle. I really deeply began to understand this about 10 years ago. And, I was in my early 30s at that time. And I really wish I was a competitive gymnast for 13 years of my childhood. And I really wish I understood this as a child, as an adolescent, as a young adult, so that I could have tapped into it through my whole life for its distinct advantages. So teaching this to even your teen and tween athletes can give them a lot of advantage, not just in their sport, but in their whole life. So you'll lose some of those natural benefits, knowing when to tune in and rest. I was just having a conversation today on Facebook with a lot of my personal trainer, yoga instructor, and physical therapist colleagues. So many are overworking or not taking that restorative time. And we even know, we're supposed to be doing that, but it's not something that has really been built into our lives from when we were young enough and began to take care of our bodies. And the menstrual cycle gives us those opportunities, and it gives us those opportunities when we're really healthy to use higher levels of estrogen and testosterone for significant performance gains. Then we'll also see that with continuous birth control, we lose some of the stress improvement, benefits of exercise, which begin in the brain. Being on continuous birth control can mask some other serious conditions. Also, continuous birth control pills deplete some vital nutrients, and some of those nutrients are very important for pregnancy, healthy pregnancy. Now, there are some benefits for athletes being on continuous birth control pills. One is that it may there's a correlation with reduced risk of the need of a serious enough ACL injury. So that's an injury to the anterior cruciate ligament in the knee requiring surgical repair. And this is a pretty common injury in adolescent and young adult women athletes who are in sports that are high risk for knee injuries, things like soccer and basketball, where a leg could be planted and the knee kicked, or, something of that nature. So there could be some benefits for your particular client. This is not a yes or no question. This is a question to put in context depending on the athlete that you're working with. All right. So let's talk about the sexual side effects of being on the continuous birth control pill. So one of the biggest problems with the birth control pill is it actually shrinks some of the sexual organs in women. The labia minora thickness and the size of the vaginal intra-aortus significantly decreases when women are on birth control pills for at least 3 months. And the blood flow to the dorsal clitoral artery and the posterior labial artery is also decreased, or there's more resistance to blood flow. And certainly sexual pleasure, orgasm is enhanced when these structures are physiologically healthy and we've got normal, healthy blood flow to the area. With reduced blood flow, it's going to be much harder and much more difficult to have sexual pleasure and orgasm, and may actually contribute to sexual pain. In women that were taking oral contraceptives for at least 3 months, they reported decreased frequency of intercourse, and I can see why. And pain during intercourse worsened after oral contraceptive use. Now, again, I was talking about, one of the things that makes me most sad about, seeing a client who is an adolescent who doesn't really understand, and maybe her parents don't really understand why she would be on the birth control pill continuously, is we lose these amazing benefits when, estrogen and progesterone and testosterone are allowed to peak to their highest levels during different times in the cycle. We get performance benefits, recovery benefits. We get stimulated to rest and recover, which all of us need and our athletic clients need as well. We lose intuitive benefits, creativity, and the ability to read the competition and think of new ways to innovate in the sport. So with a continuous birth control pill, there's a little spike of estrogen every day. It's at a nice kind of steady level, but it's far lower than the maximal spikes that you're going to get in the late follicular phase for estrogen and the mid-luteal phase for progesterone, which again limits the performance gaining benefits that we can get from a natural hormonal cycle. Additionally, there's a potential loss of the stress reduction benefits in exercise. I say potential because this study was done in rats, and you cannot always, extrapolate to humans, but this is where the data generally begins. So in this study, stress-induced elevations of certain stress hormone levels were attenuated by exercise experience in estrogen-treated rats. So those were rats that had their ovaries taken out. They had no estrogen. Some, they added the estrogen back. And then that helped with lowering stress hormone levels as these rats were exercising. And isn't one of the reasons that most of us exercise or participate in sports, depending on, the time in your life that you're in, is so that you can get those stress reduction benefits. And you don't necessarily get those when you don't have enough circulating estrogen. And this may depend. One of my colleagues, Dr. Goldstein, explains the estrogen receptors as being quite genetically variable. Some women have sort of Prius receptors. They need very little estrogen to perform the functions that they need to perform. So in women with Prius receptors, they may feel fine and perform fine and have a lot of performance and even performance gains on birth control pills. But for those that have genetic Hummer receptors and they need a lot more estrogen, they're really missing out. And we don't have a test right now to determine, which women are going to benefit from being on the pill or not based on that criteria. So just remember that if your client is on the birth control pill continuously, or even on the birth control pill at all, the stress reduction benefits of estrogen to normalizing the health of her stress hormones may be lost if she doesn't have enough circulating estrogen, which is a consequence of being on the birth control pill. Also, being on a continuous birth control pill especially, but really in either case, can also mask other conditions. PMS-like symptoms can indicate the need for a more anti-inflammatory diet, better glycemic control, and so forth. Birth control pills might mask endometriosis, PCOS, HPA axis dysregulation, which means an imbalance in the stress and sex hormones, and other important and serious conditions that when addressed early can be really healed completely from the root cause. But when not addressed for years and decades that women are on birth control pills, they can, just get worse. Also, there is a risk of difficulty with fertility after long-term use of birth control pills. In one study with women who were undergoing IVF after using birth control pills, long-term hormonal contraceptive use was found to be an independent risk factor for a suboptimal response to GnRH agonist triggers. So a suboptimal response to kind of the stimulation of ovulation that occurs as a part of the IVF process. There's also a risk of post-pill amenorrhea, which can actually be suppression of the pituitary gland in the brain by birth control pills, and this happens in up to 3% of women. More women experience menstrual irregularity, and this is on average. For athletes, it's much higher, and we'll talk about that in a moment. Also, birth control pills deplete nutrients. And look at these nutrients. These nutrients are important for protecting our athletes, helping them have healthy pregnancies, for antioxidant support, which reduces risk of heart disease and cancer, reducing risk of autoimmune diseases, and keeping their digestive system healthy and their muscles in good shape. So how do we want to approach female athletes that are in your practice and they are showing up to practice in the early follicular phase? Anti-inflammatory nutrition and appropriate supplementation to minimize period symptoms. So if they are having symptoms, we're aware of more of the underlying causes and we're dealing with it from a nutrition perspective. Omega-3 fatty acids, just simply eating a rainbow. The most common color that your female athlete clients will be missing in their diet is purple. So more beets and blueberries and purple cabbages. So just a little game to play. Anti-inflammatory herbs and spices. And we want to be assessing, is our client's digestive function optimal so that she can absorb this food? Is she eating without bloating? Is she having regular bowel movements? If she's not, just like those menstrual symptoms, those are screening red flags that need to be addressed. We also want to support the lifestyle. Again, this is the time for rest, support with childcare, sideline support. And unless your athlete is under an important competition at this time, she needs to learn at a young age, as young as possible, when to respect the need for rest and recovery in order to maximize her gains in that late follicular phase during ovulation and beyond. Energy will usually return. So if she is giving herself a couple of days of rest or, calmer workouts, restorative yoga, her energy should return approximately at cycle day 3, maybe 4. If not, again, we're screening here. This is a red flag that she may have a problem with her endocrine system, basically, and her stress response system, her HPA axis. And she may be at risk for what's now called REDS, which used to be called female athlete triad, now relative energy deficiency syndrome, because we realize it's more than just female athlete triad was dealing with menstrual irregularities, osteoporosis or osteopenia, and eating disorder. But really the effects are much wider. They're on cardiovascular health, nervous system health, performance, and so forth. So it's a huge problem in athletic populations of women. During the late follicular phase, also anti-inflammatory, but here's when estrogen is highest. So as we talked about in the beginning of this webinar, time for optimal fat intake. Don't skimp on fat. There is some evidence for the train low, compete high theory. So eating very few carbohydrates during training and then using them during competition to have that quicker, more readily available energy. And when we think carbohydrates, I want you to stop thinking about crackers and bagels and rice cakes. Let's start thinking about fruits and vegetables, soaked in sprouted grains and beans, root vegetables, juices, smoothies, and so forth. So that late follicular phase is when she has her highest potential for performance gains and competitive success. But be sure that she's aware that her elevated level of testosterone will encourage her to take more risks, and that could lead to injury. So each athlete at that time needs to be aware of this and make deliberate decisions about risk. And again, a screening reminder, if energy is flagging in this phase, she really does need to be assessed for HPA axis dysregulation or RED-S. So as I was explaining, we used to think of this as the female athlete triad: menstrual irregularities, bone loss, eating disorder. That was the triad. But as you can see, we've got a lot of data now that shows that this has much further reaching effects than what we originally thought. Immune effects, digestive health effects, cardiovascular effects, psychological effects, problems with growth and development, particularly in our young female athletes, children and tweens, hematological effects, metabolic effects, certainly hormonal effects, and also the bone health and menstrual function effects that we've always been aware of. And clearly, if you have all of these health effects, there are huge risks to problems with performance. So, there's increased injury risk, problems with strength, problems with glycogen stores, even, depression, irritability, the nervous system effects. So, this is very wide reaching, and it goes back to our athletes not respecting and not being supported to respect and taught to respect by their coaches and physical therapists and fitness professionals and nutritionists the natural cycles that come from being a woman. She needs to eat to nourish those, and she needs to take the time and space and accept the support to allow for appropriate recovery so that she can have those rock star performance gains when the time is right. All right, so that is all we have time for today. Our time is almost up, so I want you to consider joining us live. We're going to spend a day and a half, nearly 2 full days digging into this stuff in a lot of detail. I'm going to be in Atlanta with 2 of my colleagues who I'll introduce you to in a moment. We're going to learn all about how to use nutrition from a functional medicine perspective to optimize nourishment and speed injury recovery. So sometimes your clients don't come to you until they're injured. That's a great opportunity to educate and to help them recover faster. And the important thing about female athletes, distinct from male athletes, is not only are we dealing with puberty, but also pregnancy, postpartum, perimenopause. Women are active well into their later years now and are active all through their pregnancies, and we need to be confident and skilled in supporting them in all of these distinct phases. We're also going to talk a lot more about the research update, what female athlete triad, now called relative energy deficiency in sports syndrome, is all about, how we can manage that clinically. We'll be talking a lot more about HPA axis dysregulation. So how to support our sports being, helpful in reducing stress and not adding to a problematic stress response. For the physical therapists and fitness professionals in the group, we'll be talking a lot more too about structural, mechanical, and movement-based approaches to optimizing performance and reducing injury risk in young athletes. And again, athletes all through the lifespan. Nutritionists and health coaches will be learning to work collaboratively with PTs, fitness coaches, fitness professionals, so that all disciplines are aware of this holistic and important information. And we'll be talking even further into how to screen for pelvic health concerns. For any of you who have seen that CrossFit video where, women are just peeing every time they lift, or you've got postpartum runners in your practice who are having incontinence, it is not okay to be peeing when you're exercising. And we have to dig into how to manage that and decrease that risk. We'll be talking about hormonal health for female athletes through the lifespan. Are your athletes struggling with infertility? I have so many athletes struggling with infertility right now and difficult postpartum recoveries. There are so many ways to prevent these issues and other symptoms of hormonal issues. And the other thing is that we'll be talking a lot about recipes and how to continue this learning within a global community of practitioners all over the world who are thinking about this and practicing in a very holistic, whole person way. So I want you to meet Julie Granger. She'll be there with me teaching. She is a young female athlete expert. She specializes in sports specialization for girls, how to specialize, when not to specialize too much, performance all through puberty, injury prevention all through puberty, and again, screening for RED-S or female athlete triad. And I'm bringing my dear friend, Dr. Anna Kabecka. She's a board-certified integrative gynecologist and perimenopause and menopause expert. She is an expert in sexual health for women, particularly athletic women over the age of 40. She founded Magic Menopause and Sexual CPR online programs. She works with hundreds of clients every year supporting optimal sexual and hormonal health, especially in that perimenopausal and menopausal phases. As I said, we've got more and more masters women athletes, and we want them to keep exercising for a long, long time and stay healthy, not have it be depleting. The best part of doing any of this live, so we learned a lot of great information today. But when we connect in person, there is so much to gather from all of your colleagues who will be there, from the other guest lecturers. So whenever I teach live, I find that the best part, without a doubt, is the live connections that are made between the participants and the teachers. And so I am offering those of you who register for the course by this Friday in Atlanta, this Friday, June 10th at midnight, that you can join Julie, Anna, and the host of the program. Her name is Blair Green. She is a sports medicine specialist, physical therapist in Atlanta, and she'll be hosting us so kindly. We're going to go to some delicious, healthy restaurant in Atlanta and chat and talk. Saturday night, dinner's on me. I'm picking up the check. So join us for the course for the full weekend. And then if you register by Friday, you can also join us for the dinner party on Saturday night. All right. So to register to become the best resource for the female athletes in your community, you can register at the website listed there, integrativewomen'shealth-institute.com/professional-resources/FAW-live. And do it by Friday so that I can meet you and hang out with you at dinner and we can have so much fun the whole weekend. So I look forward to seeing you there, and I hope you learned a lot about how to integrate nutrition with the menstrual cycle, with the performance goals of the female athletes in your practice. And you will carefully help your female athlete clients to assess whether or not being on continuous oral contraceptives or birth control pills is the right choice for them. I look forward to meeting you in Atlanta. On behalf of Anna and Julie and Blair and myself, we can't wait to meet you and have dinner with you and have a great time this September in Atlanta. See you there. Bye.